so kind and say and spell your name if you don't mind.
My name is Kejuan Jennings, spelled Kejuane. Jennings, Jennings.
You are wearing the perfect shirt for today. I just noticed. Awesome, awesome. All right, so you're in the smile business. So you're getting your teeth all gorgeous. Talk to me a little bit about how the pandemic kind of impacted your dental appointments and your visits.
Well, it's been interesting because I was supposed to get them off like 2 months ago, but with the pandemic, they had to social distance, which is understandable. So they sent us an app, and we were able to pretty much have virtual appointments where we could take a picture of the alignment of our teeth. And then Dr. Pelsu just called during the appointment time and let me know how to rearrange my rubber bands. And so I just had to maintain my alignment until today, until I could get them off.
So you're getting them off today?
Yeah.
Oh my goodness, congratulations. That's super exciting.
2.5 years.
You know, do you feel like that was the right thing to do in the middle of this uncertainty to
Definitely,
wait that long?
definitely.
Talk to me a little bit about why.
You know, being a little selfish, I wanted them off, but like clearly we're in a real life pandemic, so I was just fine with the decision. As long as they knew how to deal with it, I didn't want it to like negatively affect my teeth, obviously, but I trusted Dr. Pelsu
No doubt about
to
it.
know what he's doing.
Do you think like it's a smart idea to like space out? I really think it helped, you know, just like we're spacing out the chairs, spacing out the appointments for people so maybe they don't have to come every 3 to 4 weeks, maybe 6 weeks, or you know, if they can do this at home, you know, saves you the gas and the trip, right?
Well, before the pandemic, my appointments were 2 months apart. You know, they come in, they, you know, tighten up some things or whatever, and my next appointment would be 2 months later anyway. So I'm kind of used to the spaced out appointments. Really, it's just the timing was impeccable because I literally was about to take them off. So it was just like, you know, right at the end of my journey is when it happened. But you know, I'm fine with it. So.
Absolutely. And today you're going to feel that weird feeling like where it's all squishy and weird, but it's going to be worth it. Talk to me a little bit about what it was like to hear the doctor tell you how you had to fix your, you know, your own rubber bands and do all that. What was that like to get that training?
It was.
You probably weren't expecting to do.
No, it was. I mean, it was interesting. It's all been a process. Every time I come in for an appointment, it's different tweaks here and there to kind of align my teeth how he sees fit, and just the overall plan. So I went with it. I trusted that in order to maintain my alignment, I would just listen to how he wanted my rubber bands to be placed during his last home stretch, and it turned out great. I love how my teeth look and how they've came a long way. So
I'm sure that they have from the first picture you probably showed me till now. Was the app easy enough to use and everything? What was that like for you?
it was super easy. It literally take a picture 4 different ways. You know, like catch the inside of your teeth, the outside in a certain angle. It literally step by step. It shows you. It has a YouTube video that shows you how to take them correctly. It aligns. You have someone else take them for you. That's the only thing. You don't want to do it by yourself. But it was super simple. It took maybe no more than 10 minutes, and I was able to send it to Dr. P, and he called me right away on our appointment and told me, okay, well, for the last home stretch, we're going to have you, have your rubber bands this way, and so that'll just maintain the alignment. So.
Were you surprised at all when he had gone virtual for this? Were you surprised?
I was wondering how they would go about it. I was. Like I said, it was the end of my journey, so I'm like, is it going to negatively affect my teeth if I, keep these braces on too long? So, like I said, I just had to trust Dr. P, and it worked out.
Virtual dentistry.
Yeah, which is, I don't know, technology. It's a new world we're living in, so I wasn't too shocked, but I was wondering how they would go about it. So it worked out.
Oh, I love it. I love
I've eaten or drinking it all today, so.
it. Okay, so it's fair to say you've been super busy, right?
I have been super busy, yes.
Absolutely. So despite the pandemic, no downtime at all. You've found creative ways to keep your clients' mouths, continuing to progress, to make them beautiful, make those smiles beautiful, right? Talk to us just a little bit about that.
Yeah, sure. So, obviously this was a big shock to the world when this happened, but to, a healthcare provider that was honestly, deemed non-essential from the beginning, where we weren't allowed to bring our patients into the office. At first it was kind of a little bit of a panic. How are we going to take care of these patients? How are we going to monitor these patients, make sure things are not going wrong or continuing to progress? And there's been a new technology just in the dental field in general that's been kind of taking off, and that Smile Doctors actually started piloting about 6 months ago, called dental monitoring. And what that allowed us to do was to virtually look at our patients' teeth, their bites, how they're wearing their rubber bands, how they're wearing their Invisalign, and first check to make sure, do you have any loose brackets? Are you wearing your rubber bands the right way? Are your aligners fitting correctly? And once we were able to do that, we then could honestly advance treatment a little bit for some people. We could have them come pick up some more aligners safely by leaving them outside, pick up more rubber bands if they needed them. We could draw on the pictures that they submitted with their app, showing a new way to wear their rubber bands, or a spot that they should be maybe working on their brushing. So it really honestly saved us during this pandemic. We were down 10 weeks, I think. Last time I saw patients was March 17th, like a full normal day, and we just started up again this past Tuesday after the holiday on the 26th. So we would have come back to probably 1,200 active patients that we hadn't seen in 10 weeks, and just had to work like crazy or have everyone's treatment get delayed. But with the app, we were allowed to check in on everybody, reassure them that everything was going okay, and then when we did start back up this week, we were able to start up with a little bit calmer of a pace, which I think was good for us, but especially for our patients, that they didn't sense any kind of craziness going on here, any more than the normal crazy of an orthodontic office.
No doubt about it. Moving forward, do you feel like, especially since we're in the throes of this pandemic, do you think that more people will like using this app to space out their appointments? Maybe they won't have to come, but once every 2.5 months now, or, especially we don't know when another wave is going to hit, to know that you're available at a moment's call to help them with spacers, or not spacers, but, rubber band placements and those kind of things.
Oh, absolutely. Over the years, as technology's developed, we've been able to stretch out orthodontic visits to 10, perhaps 12 weeks sometimes. But with today's busy schedules with kids and adults, sometimes it's hard for them to make their orthodontic appointment, or the parents have to take off work, or the kids have to miss school. But now with this app, certain kind of treatments, we may be able to see somebody every 4 to 6 months in the office, especially like an Invisalign or a clear aligner case. We can look at the photos that they submit, check to make sure their trays are fitting well, and then kind of dispense or give them some more trays at their convenience, rather than maybe them having to juggle things around in their life in order to come into the office. They could do their virtual visit really any time that works for them, which may not have been a time we were seeing patients in the office, but now we can do it that way and satisfy the demands of the busy lifestyles that we all lead now.
Yeah, I'm sure that this just brings you peace of mind. What does your heart tell you about having this virtual app and being able to use this for your patients?
Well, it also reassured me that everything was going to be okay when I got back to work, because once we all, our lives all kind of stopped for 10 weeks, but orthodontic treatment, it does not stop. Things are moving, things can break, things can move the wrong way. So being able to check in on pretty much all of those people really made me feel a lot calmer and better about what I was going to come back to once we reopened after the pandemic.
Absolutely, no doubt about it. And with regards to this, I understand people had to maybe get creative with you too, in those tough times. They had to learn how to maybe fix a wire, with some, nail clippers and
Yep.
things like that. You had to do some things like and get out of your comfort zone, I would imagine, with your patients.
Yeah, we were able to guide people. Some parents, I think, were a little hesitant maybe to put their hands in their kids' mouths at first, but knowing that they may not be able to come in and their child may have been in pain or they themselves may have been in discomfort, they were able to use tweezers or use a nail clipper and cut something or move something a little bit. And I think where they had a little bit of fun too was actually taking the pictures either on themselves or on their kids. They used spoons as cheek retractors. They used cheek retractors, and I can never remember the name of that game where you have cheek retractors that you put in your mouth and you have to try and say things with the cheek retractors in place. People use those for their photos. And we were actually pleasantly surprised at how well most of the photos turned out. So we were very proud of our patients and the skills and abilities they developed over this pandemic.
No doubt about it, because if they can show you the tooth, then you can really tell what needs to happen next.
Absolutely.
You have to see it visually,
Yep.
for sure. That's the critical element. So we've got the capturing from the camera, the phone technology is there. We've got the parents that are helpful, or just having somebody else in the house that can do this for you. Really zooming in on that, hey, it sounds like you were able to guide people through putting on rubber bands and placement things that normally you take probably 20 minutes with an inpatient procedure or visit to talk with patients with, and now you can do that in a virtual setting.
In a virtual setting, yeah. That was the cool thing about the app, is that we were able to literally draw on the photos that they submitted and then resend that picture back to them. And it looked like somebody, making a meme or, drawing on a picture with their phone. But it was the same thing where we could draw a square or a triangle and show them where to put them, on those teeth or the new teeth we wanted them to wear them on, which again allowed us to maybe advance things or move things along a little bit more quickly, which we wouldn't have been able to do, and their treatment would have been delayed. So.
No doubt about it. And I think that the cool thing too is that, as we talked about, moving forward, it's something that you're planning to keep, right? I mean, this was just not for the pandemic. This is full time now that you're offering this to your patients.
Absolutely, yeah. So our company as a whole started kind of trying it out about 6 months ago with the plan to eventually adopt it in all of the offices, and the pandemic just kind of sped up that adoption to every office. But what it has shown us is that it is something that we will want to continue using, because again, anything that can make things more convenient for our patients, their families, by not having to come in the office or do a visit when it is a little bit easier for them is great, not only for them, but also for us. And, with the whole concern about too many people in, a closed space at the same time or getting close together, we can also limit the number of people in the office now, whereas before we couldn't do that. So just for overall, peace of mind of staff and patients.
Tell me too about you guys have these. Are we one of the first to pilot this in Wisconsin? Go ahead, toot your own horn a little bit.
Yeah, I think we were. Just our Janesville and Madison locations were the first, as far as I know, orthodontic offices in the area doing it. So yeah, it was kind of cool to kind of lead the wave, and it kind of generated a little bit of buzz. I had our local paper wrote an article about it, and the cool thing is that she was her daughter was actually in treatment with us, so she kind of was able to document the whole process, right along. So it's been fun, and I know that it kept our staff busy. It allowed us to keep some people employed too, which was great. Where a lot of offices had to completely shut down. We had several staff members coming in every day the whole time, which I think was a benefit, obviously, to them and their families as well, too.
Yeah, I just love how you said, when you've got 1,000+ patients and you're seeing them constantly coming through your doors, being able to make those house calls, so to speak, virtually through telemedicine. I mean, it's, who knew we'd be talking like this now, but that's
Exactly.
our new normal. So this is part of it. Very cool. I probably have plenty. Anything you think I've forgotten to ask? I've stolen 10 minutes of your time instead of 5 that I promised. So anything?
Yeah, I guess one other thing that I think we sped up with this is we started doing new patient, exams or consultations this way. And what we also then adopted was kind of an at-home impression kit. So if somebody was really anxious to get started, and we're going to continue this too, is that we can send them off, to take at-home impressions, get some Invisalign aligners made, and then just start some real minimal tooth movement before we actually have to see them in the office. So that was another kind of leap that we made during the pandemic, was starting that process as well. So.
Very, very cool.